Hello and welcome to the 2021 Cancer Foundation of Santa Barbara Virtual Return on Generosity Celebration. I'm Lori Willis, the Executive Director of the Cancer Foundation. Over the past 9 years, the Cancer Foundation made grants to the Ridley Tree Cancer Center in excess of $20 million. In 2021 alone, this figure tops $2.6 million, with an additional $4 million authorized by the Board of Trustees to construct and install state-of-the-art technology, which will be the first of its kind on the Central Coast. Many of you have not had the opportunity to step inside the doors of the Ridley Tree Cancer Center since construction finished in the fall of 2017. Join us as we walk through the building and meet the staff who can tell us about the programs and services the Cancer Foundation supports. Learn how many programs pivoted during COVID and see a sneak peek of what is coming to our community next year. Let's step inside and see all that is possible because of community members like you.
My name is Young Mi-an, and I'm the Manager for Educational Programming and the Resource Library. Each year, I respond to hundreds of inquiries from patients, Ridley Tree Cancer Center physicians and staff, and community members, providing comprehensive information about all aspects of cancer. The research assistance that I provide supports our evidence-based approach to care. Patient information services are so valuable because patients are empowered when they are well-informed, which improves communication between patients and their healthcare team, and increases patient satisfaction. For much of the past 18 months, the library was closed, but I was able to continue providing services via phone, email, and mail. Despite the fact that we have not been able to hold lectures in person, more than half a dozen programs were recorded and made available online, including Advances in Melanoma and Skin Cancer Prevention, and the Science of Sleep and its Effect on Health.
As the premier provider of radiation oncology in Santa Barbara County, the Ridley Tree Cancer Center provides the latest treatments available, including stereotactic radiosurgery, brachytherapy, and image-guided radiation therapy. Our radiation oncologists are board certified and have received extensive training from world-renowned institutions and practice at academic centers of excellence, including Harvard and UCLA. When our new campus opened in 2017, the Ridley Tree Cancer Center earned accreditation for radiation oncology services from the American Society for Radiation Oncology Accreditation Program for Excellence. Our radiation oncologists collaborate with medical oncologists, surgical oncologists, primary care physicians, and other specialty physicians and members of our supportive care programs to create a coordinated and multidisciplinary approach to cancer care to ensure the best possible outcome. In 2020, the department formed an affiliation with the NRG Oncology Network in order to increase radiation oncology clinical trial opportunities for patients.
The Wellness Program aims to help patients take an active role in their health, resulting in a calmer mind, a healthier body, and a renewed capacity to cope. Hi, I'm Sam Howland, the Director of Patient Support and Integrative Services. We're pleased to offer a wide range of wellness classes, activities, and programs to our patients and their caregivers, including yoga, qigong, meditation, exercise programs tailored for all phases of treatment, from diagnosis through survivorship, painting, flower arranging, knitting, and more. Despite the challenges posed by the pandemic, many of our long-standing classes pivoted and instructors were able to offer programs online. Whether we are together in person or online, our goal is to provide a safe place for those in the midst of a difficult time and to provide a healing and supportive atmosphere.
Welcome. My name is Danielle Sharaga, and I am a genetic counselor and manager of the Genetic Counseling Program at the Ridley Tree Cancer Center. As a pioneer of genetic counseling programs in California, our department offers hereditary cancer risk counseling to more than 700 patients each year, helping those with a personal history or a family history of cancer better understand and manage their risk of developing cancer through genetic risk assessment and genetic testing. My team translates complex genetic information into understandable recommendations for patients, healthcare providers, and families. Because results of genetic testing often directly affect the course of treatment or future surveillance for a patient and their family members, we work closely with the patient's oncologists and surgeons to allow for the timely application of information into a patient's care plan. Virtually overnight, our team hosted 100% of our appointments over telehealth to provide greater flexibility for patients and families during COVID. Our goal is to provide confidential information, reassurance, and support to cancer patients and their families.
My name is Dawn Elliott. I am a patient navigator and the Patient Navigation Department Manager. As navigators, our role is to provide education to patients and families, offer support at times of transition in care, and serve as a liaison between individual patients and various healthcare providers who are required for proper diagnosis, treatment, and disease management. During the pandemic, my team quickly transitioned to working from home so that direct patient communication with navigators continued seamlessly. We give each patient and their families the time, support, and information needed to make an individual plan that is personalized, effective, timely, and supported by available resources. We tell our patients, "I'm your person. How can I help?"
Surgery is the original treatment for cancer, and it remains a key component in the care of patients living with cancer. Ridley Tree Cancer Center surgeons specialize in various types of cancer, including breast cancers and gastrointestinal or GI cancers. And they provide comprehensive evaluation, treatment planning, and surgical approaches to ensure the best possible outcomes for patients. Surgical treatment together with medical and/or radiation oncology are the mainstays of cancer care. Depending on the type of cancer, surgery can occur before or after chemotherapy and/or radiation, or in the middle of another treatment like chemotherapy.
As the Oncology Social Work Manager, my team and I know that cancer can result in significant psychological, social, and economic challenges for patients and their families. Hello, I'm Amy Shapton. Caring for the whole person and not just the diagnosis is an important aspect of each patient's plan of care. For this reason, my team and I provide emotional and practical support for patients and their loved ones. We can also provide advocacy and community referrals, as well as individual and family counseling services. Our services are designed to help meet the needs of anyone in our community, regardless of where they are receiving medical care.
My name is Sarah Washburn, and I am the manager of the Oncology Nutrition Program at the Ridley Tree Cancer Center. Nutritional health plays a critical role during treatment and survivorship. As board-certified and trained specialists in oncology nutrition, we share evidence-based information that supports improved treatment outcomes, enhances quality of life, and decreases the risk of disease recurrence. Through a patient-focused, personalized approach, we help our patients optimize their nutritional status and correct nutritional deficiencies, which can result in fewer treatment interruptions, side effects, and unplanned hospitalizations. We offer individual counseling during treatment, which often continues until a patient experiences improved health.
The Medical Oncology Department delivers chemotherapy, biologic therapies, immunotherapy, and supportive treatments for cancer patients. The Ridley Tree Cancer Center's personalized approach to treatment requires close collaboration between all the clinicians involved in the care of the patient. Medical oncologists collaborate with other oncologists, community physicians in private practice, as well as primary care and specialty physicians to create a coordinated and comprehensive approach to cancer care. All of our oncologists are board certified and come from some of the most prestigious training programs in the country.
Hi, I'm Jacob Medina, a member of the clinical research team. Our work leads to the development of improved treatments and advancements in oncology care, which results in a better future for all cancer patients. Physicians here at Ridley Tree Cancer Center are involved in clinical trials that test the newest treatments and provide our patients access to cutting-edge therapies from across the world, right here in our own community. With a 30-year history of clinical research, the Cancer Center is home to one of the largest clinical research departments between Los Angeles and Palo Alto. We partner with U.S. Oncology Research Network, the Tempus Time Trial Network, leading pharmaceutical companies, and universities to access many clinical trials that deliver the best treatments science has to offer. The physicians at the Cancer Center work with the clinical research team to review records to identify patients that stand to benefit from the promising new therapies here offered in clinical trials. Participation in clinical studies allows us to offer the best possible range of treatment options to our patients.
Hello, my name is Dr. David Carlson, and I am a nuclear medicine physician at the Ridley Tree Cancer Center. Since 1956, the Cancer Center has offered nuclear medicine services on the ground floor of Cottage Hospital to provide both inpatient and outpatient care. Nuclear medicine plays a critical role in cancer diagnosis and treatment by capturing images that deliver vital information about the function of cells and major organs. This involves the use of radioactive materials to create images that allow me and my partner, Dr. Bill Pace, to study the structure and measure the function of organs and to identify tumors as well as areas of infection or other disorders. For cancer patients, this typically includes a whole-body PET-CT scan to identify the location of cancer as well as the possible spread of disease. Subsequent PET-CT scans are often done to tell if disease is getting better or worse. Serving more than 4,000 patients annually, we are excited to expand our state-of-the-art capabilities next year with the acquisition of a digital PET-CT scanner, which will be purchased by the Cancer Foundation. This equipment improves image resolution by 2 times, allowing for detection of smaller lesions while reducing CT radiation dose. The new digital PET-CT images show disease that would potentially be missed with a non-digital system, which increases diagnostic confidence and allows early diagnosis and potentially improving patient outcomes. Although nuclear medicine exams are notoriously long, the new scanner will allow for images to be obtained at a much faster rate while providing exceptional image quality.
Hopefully this walkthrough gives you a sense of all of the very important work taking place in this building, but there are many other things that we haven't been able to show you, such as the children's sun safety programs that we support in conjunction with United Way, the acupuncture program which relieves stress, anxiety, and pain for many of our patients, and the impact of the Maravik Fund, which ensures financial support for medical treatment, procedures, medicine, and copay obligations for local residents. Because of your generous spirit, these programs and services are available at no charge to the members of our community, which continues the promise that Elijah Converse, our founder, made in 1949, providing superior cancer care close to home. The Cancer Foundation of Santa Barbara remains committed to providing the financial support necessary to take care of patients' healthcare and related needs with, through, and beyond cancer. Thank you.